Thank you, Mr. Chairman. I'm sorry that we are convening today's markup. The opportunity existed for a bipartisan bill that would have moved this bill forward quickly. Instead, we're in for a contentious markup on 3 bills that will likely make it more difficult to move a bill that has a chance of becoming law. I reject the notion that partisanship means success. It never does. When bills are reported out of this committee that are partisan, they almost never become law. And that's likely the case with this one again, unfortunately. Let me quickly note the 7 Medicare-related bills that passed out of subcommittee unanimously. They are bipartisan, and they make a number of different positive policy changes to our Medicare program. These include improving our meaningful use program, increasing our ability to timely treat stroke patients, removing barriers to speech-generating devices, providing coverage to critical prostate cancer testing, expanding home-based primary care, and strengthening our competitive bidding program for diabetes. We also will update civil and criminal penalties in the Medicare program, an important component to ensuring the integrity of the program. Now let's get to the contentious legislation. First is IPAB. My feelings on this board are no secret. I have never supported ceding our congressional authority to the executive branch, and I'm on record in opposition, but I'm upset by the timing of its consideration by this committee and troubled by the hypocrisy of the GOP, who don't feel the need to offset the nearly $18 billion cost of the bill, yet somehow we've got to pay for the extension of children's health care, community health centers, and other health programs by undermining the ACA and Medicare, and therefore I will oppose the IPAB repeal today. Mr. Chairman, I believe that things could have and should have been different. You and I have spent the better part of the last week trying to negotiate what could have been a bipartisan package to extend critical health programs that expired on Saturday. These programs have brought bipartisan delay and possibly no action in Congress until the end of the year as part of an omnibus appropriations bill. I think that's unfortunate. So today, instead of marking up a bipartisan package, Democrats are being asked to sacrifice the health of some for the sake of others, and Republicans on this committee continue their ongoing sabotage of the Affordable Care Act by cutting the ACA's prevention fund and limiting the grace period, which will strip health care away from hundreds of thousands of people, and it also undermines Medicare. After failing to repeal and replace the Affordable Care Act, it's outrageous that the GOP leadership continues its efforts to sabotage the ACA. At the same time, we're looking to reauthorize CHIP. Community health centers and other important public health extenders. Let's not forget that if both CHIP and community health centers are linked, they are linked to the ACA, and if the ACA continues to be sabotaged, it will inevitably hurt CHIP and also community health centers. So my concern, again, is that this ongoing effort to sabotage the ACA and also Medicare is inevitably going to hurt our efforts to try to reach any kind of consensus on CHIP and community health centers, and that we will, again, find that this bill is a failure and has very little possibility of moving forward. But with that, Mr. Chairman, I'll yield back.